Oh, hip pain. I got arthritis in my hip. If you think you've got this, we're going to show you some simple exercises that are going to help mitigate and get rid of that hip pain so you can get on with your life again.
Yes, many people think hip pain is due to their arthritis, but actually, many people have hip arthritis when they get x rays, but they actually don't experience pain. So, we're going to show you some stretches and exercises you can do to strengthen that hip up and make that pain disappear.
There you go. All right, now let's look at one of the primary causes that we're finding why we have hip pain and involved with some arthritis, and it's a term called anterior femoral glide. In other words, if we look at Sam here, we look at his hip, the ball of the femoral joint is actually moved forward. That's called anterior. And then we get wear on the joint that actually promotes arthritis and pain. So, Mike, what are we going to do about this?
We're going to use a belt or a band stretch we will show here in a little bit, but essentially what it's going to do is go in front here and help pull this back into place where it is supposed to be. This will help alleviate a lot of pain if it works for you. And then we're going to show you some exercises and stretches to help keep it there over time.
Right, because it's rather interesting. Actually, the glute muscle in the back of the hip is actually becoming weak in a lot of people, allowing for this anterior movement of the hip. So we're going to strengthen that muscle after we stretch it and pull it back where it needs to be, therefore eliminating the problem as opposed to just treating it temporarily. All right, we're going to show you some exercises that are going to help eliminate this pain, but we need to give credit where credit is due. Actually, these were developed by a therapist. His name is Rick Olderman. He has a number of books written, one of them is specifically for the hip, and his exercises have been field tested by himself in his clinic for over 20 years. They definitely work. Mike, let's show them.
If you want to find his programs or books, you can go to rickolderman.com to find that information. Now, the first exercise we're going to do is to help get that anterior femoral glide syndrome issue solved, like we're showing on Sam earlier. You're going to need either a belt or some type of loop band to do this exercise, and something sturdy to tie it around, maybe a stair railing like we have here. If you have a very large, strong dining room table, you could certainly try it as well. Now, I don't like the belt as much because I can't stretch as far. I'll show you why, but it does work. So what you're going to do is put it in the front of your hip muscle as high as you can, kind of in this crease region here, and you're going to simply pull forward. This is going to help put that femoral head back in place. Now, if you feel a pop or something good right away, it decreases your pain. This is the right stretch for you to do.